So, Rhiannon Lambert, thank you for joining us. I'd love to know, and our listeners would love to know more about you. So, could you tell us what is your mission? Why? What is your why behind your science and nutrition communication?
It's a very good question. I think the why is often the most important thing. It's the thing that actually keeps you going in the job that you do. My why has actually stayed the same. I'd say initially getting into this field of nutritional science, I came from a musical background. And it was working on people's relationships with food, clinic, looking at psychology and nutrition very heavily. I actually did a master's in obesity risks and prevention after my undergrad at university. And I really did think that was the route I was going to go down with my nutritional career and the reason I set up my clinic. But actually, over the last decade, the relationships with food have spanned so much further into now I see my role very much and my why as delivering evidence-based nutrition and genuine messages to the public, because I feel that with the eruption of social media, the confusion online, everybody is a nutritionist or a dietitian these days. Apparently, if you have a following that's large enough, I feel my mission really is to cut through that. And that's what I do with the Nutrition business. So I have a clinic, the Nutrition Clinic, with multiple health professionals, psychologists, doctors, nutritionists, dietitians. And we work in a multitude of areas from pediatrics, gut health, women's health, eating disorders, sports nutrition. Then I've just got my new community page, Nutrition Plus, where we bring affordable clinic sessions to the public. So over an 8-week program, we bring affordable sessions from my clinic team if you're a member of our inner community on Nutrition Plus. And alongside that, I'm an author. I've got 7 books at the moment. There might be a few more on the way. And I see my role very much as breaking down complicated noise. And that's my why. I see the destruction it causes in my clinical practice.
Yes, and a lot of our listeners will be nodding their heads at that because they will see the confusion that they have in their clinics with patients coming in asking them confusing topics on social media, and you do a great job at that. And that ties us into really nicely into our first couple of questions. And you mentioned the books you've recently published, and one of them, The Unprocessed Plate, was looking at how we can turn our plates into more fibrous, delicious meals, and how we can reduce our consumption of ultra-processed foods. So let's start at the very top for our listeners. Could you define for us, because there is a lot of confusion, what are ultra-processed foods?
There is so much confusion on this topic, ultra-processed foods. I think largely because the word processing applies to so many areas of the modern food environment, you really need to have this definition to understand what we're discussing. So ultra-processed foods have potentially been linked to poor health and excess. Now, by the NOVA criteria that most of us health professionals are using, probably actually needs an update. And I know the team at Zoe have their own new criteria they're using, which scales a risk of harm, which might be helpful to any listeners as well. But NOVA was developed by Carlos Monteiro, a researcher over in Brazil, and he created these 4 different categories. And category 4 is ultra processed, and category 1 is mainly be the apple you pick from a tree, going up to perhaps let's press that apple and put it in a bottle of juice. Or putting your chickpeas into a can of chickpeas on the supermarket shelves, or beans or pulses, and you work your way up. But the issue we've got is category 4 often will have preservatives, emulsifiers. It's where food science plays a role. We have developed and engineered food over a long period of time, industrially processed ingredients that we mash together. We make up different food because initially we wanted it to be accessible. We wanted to fight food poverty. There were reasons. I like to believe there are good reasons why scientists created these foods. But of course, the wider issue that we can't ignore is the hyperpalatability and the fact that crisps and chocolate bars and delicious drinks and energy drinks and all sorts of things you find on the shop shelves, sadly often marketed towards children as well, contain a lot of sugar, fat, salt, and extras, additives. They're things you would not find in your store cupboard at home. And the issue we've currently got is that in the Western world, adults are consuming a lot. We're talking up to 60% in the UK. Children actually have the highest intake in the UK in the world, up to 70% of ultra-processed food items. That in turn, we believe in nutritional science is having negative consequences on our health.
That is such a good point, and there's a lot to unpack there. And again, yeah, ultra processed foods, people are demonizing them, but they can be anything from life-saving shakes in the hospital, and food and shakes that help people rehabilitate after surgery or ill health, and we should not be demonizing these, all the way through to actually your staples, some of them.
Baked beans, staples in the UK, that's for sure. Yeah, everybody's favorite. They're ultra processed, plant-based drinks that are alternatives for those with cow's milk protein allergies and all sorts of things, lactose intolerance. So it's confusing because the category is a mixture of beneficial and very unbeneficial items.
And you said that statistic there, up to 66% of adolescents or children, and over 57% for adults are getting their total calorie from ultra processed foods. Could we? We're going to talk more about what we think is the drivers behind that shortly. But I know this is a short question to a really long answer, but why are we eating more ultra processed foods in the UK and within North America, Australia, other countries like this?
It's my belief that now it is a very big answer, and I'll try and keep it short because we've got food poverty, privilege to tackle in this answer as well, of course. But I think ultimately we've lost the cooking skills. We don't cook from scratch. Cost of living crisis. We know that from the Broken Plate report, which is actually due to be updated this week, I believe. So I'm gutted I don't have those stats for you to hand today. But the previous one that came out in 2025 said it's twice as expensive to eat healthily in the UK, and I'm sure that rings true for other countries around the world. When and in fact, I had a good map and image in the unprocessed plate book that explains these factors. It's convenience, and it's a lack of food education. We have no nutritional education in the school systems that's up to scratch, in my opinion. I'm talking about starting as young as nursery ages, those key years from 0 to 2, how to even feed a child correctly, going up to 2 to 5. School years start, we're looking at a complete and utter pandemic of children that don't know where food's from, don't know how to eat well. And very sadly, generations have lost that art of cooking, and we're buying and buying and buying more convenience items that are marketed to us as healthy alternatives. Marketing plays a huge role here. Oh, look, let me solve your problem. This contains vitamin C. Let's put a claim on a packet. Therefore, it's good for you. But actually, it's not a whole food item. It will lack all of the beneficial nutrients and the amalgamation of the food matrix. So it's a big, big question. But in short, we're time poor and we're struggling, and we don't have the education anymore, or the food culture is dying as well.
The food culture, and I think that's a really important point because in countries just across the sea from us, France, Spain, Portugal, Italy, the food culture there is really strong around eating with a family and cooking from scratch. We seem to have lost a part of that in the UK, and it is sad, but large forces have driven it, as you said, economics and lack of time, and I think that's a really good point there about the fact that children, are losing the ability to be able to name fruits and vegetables that are on their plate, and I guess that kind of goes to my question. If you were counselling the government and major stakeholders, what counselling advice would you give them?
Well, I'm actively involved at the moment with several charities that work on this in the UK, the Food Foundation for one, and they spend a lot of time trying to insist, first of all, it's a chicken and egg issue. We need to actually change the food environment let alone look at the preventative counselling measures that we'd love to put in place with food education. So we have to, first of all, tackle the meals that are offered in state systems, school food, convenience outlets for people that are on the go. I think the major difference, use Europe as an example. If you look at other countries in Europe, now actually their ultra processed food intake is higher than you'd think if you have a look on the map. So their culture is also being infiltrated, but they've maintained a core basis. And Spain actually rolled out a ban on ultra processed food items for children, nationwide ban last year, so 2025.
Wow.
They've also, there were other measures in different countries saying no red and processed meat on the menus for children. You know, other countries are actively rolling this out. France has a fantastic initiative where they use seasonal ingredients in schools, and they seem to have a really good food system in place. We don't seem to have that in the UK. The rollout of where we get produce from, perhaps we import a lot of food. There's different ways of looking at the structure. It stems all the way back to issues of our farming, our agriculture systems, the value we place upon food. But in our opinion, when we're looking at discussing these issues of government, which I do a lot, it often comes down to money. And you're saying, look, if we can change the food environment for our children, you will be reducing the cost long term on the NHS and the health outcomes on those that are dependent upon your services as they age, because we know metabolic diseases are so high. We know that's predominantly lifestyle linked for many, many people, and many cases can be prevented throughout diet. Just look at the rates of, this is obviously different to metabolic disease, but cancers, and bowel cancer in particular is a really sad example that I've written about in both of my books, The Fibre Formula and The Unprocessed Plate, where up to 60% of cases can be preventable via diet. And fibre is lacking. I know we'll get onto that later. But when we come to government, we need a food environment change first. That's what we offer to children at school. Visibility, meals, produce, the type of produce, the bread we're buying for children, the pasta, the sauces that come in the big packets. And that's new guidance that has come out, but it's guidance. It's not yet mandatory that a portion of vegetables should be included at lunchtime, for instance, with a child's meal.
Some really positive points there. Has there been any research or positive news from those rollouts within Europe or other countries around the world?
Yeah, they're working. And I think what's so interesting is, I think when we look at models of places in the world where food is working well, Scandinavia is a massively positive example. When we look at the data, we look at the rates of ultra-processed food consumption, the rates of health as people age, and also the obesity numbers. You know, when we're looking at, of course, obesity in children, as you will know, and everyone listening in your profession, the rates of tooth decay, even all these certain aspects that are linked to food. Scandinavia seem to have it right. And these countries that are doing well from the data are the ones that are investing into pound per meal for child at school, into whole food produce, into more sustainable systems in the supermarkets. The caps on advertising, and this is something a charity, or I should actually say an action group called Bite Back, which is a lot of young campaigners that work here in the UK. They're desperate to see change. They're fed up. And I feel there's a real consensus of just stop advertising junk food and food that is not beneficial to our children and to the youth of today. They're not going to put up with it for much longer. So we should start to see these positive changes and take a leaf out of these countries' books where they really have cooking systems in place at school. For instance, there's no cookery lessons that are compulsory at schools in the UK.
That's really sad to hear. I remember growing up in primary school having food tech classes, but I'm sure they were cut out because of pricing, and
or they'll just be 4 to 5 weeks long. You know, that it's not enough, and it's not starting young enough. We really need to infiltrate down to where they're the most impressionable years is under the age of 8. We really need to infiltrate food to be this positive, wonderful aspect, so we can get a bit of our food culture back. 'Cause like you say, these European countries that have hung on to it have got the most incredible social aspects around food ethos. Look at Asian cultures when they sit down together. Look at in Italy, where meal times is such an art. They're very proud of their food, and that also plays a role, but that's more of a social aspect as well. So there's lots of factors where I feel we're a tad broken in the UK, and where ultra processed foods have crept in to fix a problem. I must also add, sorry, just to go on and on,
That's right.
but there's also a huge, there's a huge gender issue here when it comes to food and women entering the workforce, and there being no solution or support for them at home, because traditionally, of course, you had gender roles where the men would go out to work, women raise the families, they spend the time at home doing the shopping list, budgeting, cooking all the meals. You know, I'm a mother of two, and I understand the time constraints, and I own my own business, and I don't have time to make home cooked meals every single day of the week. So it's almost asking an impossible task of families where the infrastructure is still archaic and there's no financial support in that area either. So it's a big, big issue.
In the UK, what are the most positive drivers of food culture that you think we have?
It's a very good one. I would say a positive driver that we probably have, I think, occasions. We do get together for occasions, you know, be that if the sun comes out suddenly, everyone will run outside to their barbecue. Now, we could go into barbecue food, but generically speaking, it's a social occasion where people celebrate food positively. Birthdays, but again, these are rare and few between. Perhaps the traditional Sunday roasts are an example of a really good standard staple. Most people don't realize it's just a plate full of often vegetables, a protein source, depending how far you go. We don't have as much of a positive drive towards these social aspects, but those few we really need to maximize on and really try and enjoy it. When it comes to sitting down at the table, there was a statistic that came out last year that said something like, I think most families only eat once together across the course of 7 days a week. And I can well believe it, because we're working longer and longer hours, and we're not able to always sit down with our children and eat food with them. So sorry, I think you may have got a notification from my phone there that just went off.
No, you're all good.
Okay, you might have to edit that bit, sorry.
No problem. I didn't hear anything.
Oh, amazing. It was just my ear went ping. But ultimately, let's try and embrace the few social occasions we have and make them an excuse to make that big potato salad. Stop demonizing foods that are traditionally very beneficial for us, and really try and make them a positive experience.
Yeah, I think that's really important too. I know that there is so much negativity around the statistics of what's happening within the UK and globally around food and its drivers for ill health, but we need to think about the positives and really promote those, and find ways to big them up and actually say, you know, there is
Let's
a positive light.
Talk about traditional meals that are underrated. Cottage pies, shepherd's pies, lasagnas, you know, what people would describe as comfort food. A pie, for instance, those can be made to be really rich sources of fibre. They can be lower in saturated fat. And that's what I focus the recipes on in my books, is things that are easy and accessible, but have been nutritionally calculated. Because, you know, if you go out to a restaurant, let's take mashed potato as a classic example of the ultimate comfort food. If you eat in a restaurant, they'll add a whole pack of butter, and I'm not exaggerating, to create the perfect whip. But when you're at home, you can do that with a splash of milk and butter and mix your mashed potato. And you can also try blending with your mashed potato some swede, or you can change it to sweet potato or basic white potatoes. There's nothing wrong with potatoes. And if we all just cooked a little bit more, these meals that we think are stereotypically bad for us because they're stodgy, especially in the winter months in the UK, actually cooking those traditional, lovely, delicious meals is much better for your health than buying that ready meal in the shop.
I fully on board with eating more potatoes.
Yeah.
And the amount of different types of meals you can make with them, it's pretty impressive.
Yeah.
I do love the story of the potato, how it's just came from South America and then just appeared into our lives in Europe and the rest of the world, and we just transformed us. It's a pretty magical piece
Well,
of
we grow them so well here. We've
food.
got the perfect climate for so many wonderful traditional spuds. So yeah, it's all those sorts of things. But this is where social media can be so dangerous, is that it demonizes our staples. You look at households, I would say probably 90% of households in the UK consume bread. Yet it's one of the most demonized, pathologized items of food. It's crazy.
Yeah. We were. I'm going to move this on to the mechanisms of ultra processed foods. I know that we can come back to some of the more positive things, but what is the data on the breakdown of ultra processed foods? So let's say 66% of total calories are coming from ultra processed foods adolescents. Is that whole grain bread? Is that cereals? Or what is the breakdown of that data?
We don't have enough specific information to break down the data and pinpoint, but what we do have is the large cohorts. For instance, in November last year, The Lancet pointed out all those terrifying headlines that ended up everywhere that, they're linked to early death, the more UPFs you consume. I would probably go as far as to say that most of that data is on those low fiber items. Action on Salt brought out their data last week, and I believe it said that 97% of sandwiches, for instance, people buy on their lunch breaks in the UK did not meet the fiber requirements and were high in salt. 97% of sandwiches. So basically no sandwich you can buy in the UK contains enough fiber at lunchtime. And it's those types of things that are so fascinating, because when you do delve deeper and you have a look at our convenience foods, it's quite difficult to make a healthily, nutritionally balanced convenience food that's palatable, that has a long shelf life. These foods are designed, as we know, even the ones that you would consume in a hospital-based environment that can save lives, they have to be palatable or people won't consume them. You have to add the sugar. And a lot of the time, sadly, that comes at the consequence of taking more of the whole foods out. So the data most likely is skewed towards that range. And I would say, I wish we had an individual breakdown on how much red and processed meat is consumed, for example, in the UK. That's one of the leading drivers we know as well, linked to cancer. And one of the largest food groups that is commonly consumed, it's a staple, a ham sandwich in the UK. White bread, low fiber, high salt, lots of preservatives, and then preserved meat. And it's just a unhealthy recipe. So I would go as far as to assume that most of that percentage that we're discussing is probably not the high fiber, healthy, small percentage of the market. They also cost more. These products that are engineered to be better for us actually can price people out a lot of the time.
Yeah, and these meal deals are pretty popular in the UK. They are a social phenomenon.
Yeah. What we have as well, which might be helpful for you, is that I've got this written down, is that 44% of UPFs that don't trigger the high fat, salt, sugar warning, they often are the things that people are having that come from things like soft drinks and beverages. So they don't even tick the same markers. So a lot of people consume energy drinks, they consume these beverages, and it's those sorts of things that I think people probably have more frequently than they should, which is one to take into account, definitely.
Okay. And there'll be some listeners who are medical and may not know nutrition science so well, and they'll say, okay, so ultra processed foods, there's an association with disease risk, but that's a correlation. What are the mechanistic realities? What do we really know about the mechanisms behind eating ultra processed foods, and increased risk of ill health.
It's definitely something we need more
Non-
studies on, because I think that's one of the most debated areas of the science. And that's why people are very confused about this area. Even the fact we don't have an updated criteria for defining ultra processed foods screams the volumes here. But let's talk about simple things first of all, like a lack of chewing in food. Even when you don't chew, you're impacting your gut microbiome. So what we're discussing here predominantly, if we start by explaining the new science of the gut microbes, which are amazing and overwhelmingly complicated, but incredible science. And all you really need to know is that when we eat more fiber and less ultra processed foods, you chew your food more. Your gut bacteria are grateful for the fiber that you consume. That bacteria give off these byproducts that can protect your gut lining, reduce inflammation. We know the gut bacteria play a role with training our immune system. We know how closely interlinked our immune system is with that area now. And I'd like to think lots of your doctors listening would be very interested in that area of research, because the microbiome and the living bacteria there is fascinating. What we know is that ultra processed foods don't benefit the gut bacteria at all in a positive way. They're not feeding them the diversity. We've got multiple studies and research studies, the American Gut Project, all sorts of things coming out saying this magic number. I discuss it in the fiber formula, but 30 plants a week, 30 grams of fiber a day, chew your food 30 times. One of the mechanisms that we're missing is that aspect of how we eat our food. That's mechanism number one, is the lack of the fiber, the lack of chewing, these hyperpalatable items that then are also triggering our blood sugar levels very, very quickly as well. So a lot of these items, as I've said, will be low in fiber. So straight away, you're going to be seeing a larger response in your blood sugar and your insulin. Often they have added sugar and salt as well on top of that too. And then you're bound to eat more of them in a shorter space of time. So the link isn't just the weight gain. The link is also on the blood sugar continuously. As we know, it takes a long time. And this is a continuous thing that you need to be, it's chronic, not an acute response every now and again. So you've got blood sugar levels, you've got the lack of fiber. You've also got the impact on how we break down with soluble fiber, the impact on cholesterol levels, of course, as well, and bile acids and reabsorption, and how we're actually excreting through stools. We want heavier stools because heavier stools are linked to better outcomes and longevity. And people that have diets high in ultra processed foods are not going to be getting heavier stools because of the lack of fiber. Then you've got the lack of nutrition, malnutrition potentially from these diets that are high in ultra processed foods as well. And then you've got this grey science mechanism area of, is the emulsifier harmful? Is the artificial sweetener actually harmful? And the overwhelming evidence is that they are safe to consume. But researchers are now exploring the impact and the conversations these emulsifiers and additives are having within our gut bugs. And in fact, there was a lot of investigation looking at IBDs in particular back in 2025, again, with intakes of ultra-processed foods. The emulsifiers in particular were found to be not beneficial in those with Crohn's disease, for instance. So obviously, we need to explore that. But if you potentially have a bowel disease or you're not functioning very well, having these emulsifiers and preservatives in your diet is also linked to poor health from that aspect too. So we're talking weight gain. We're talking poor relationships of food, from dopamine release from these. Ice cream is the perfect scientific formula, isn't it? You've got fat, you've got sugar, you've got those things that really kick off those reward centers in your brain. I'm not saying the food itself is addictive and the pathway is the same, but I'm definitely saying it does trigger a dopamine response. And there's a reason you eat that whole bag of crisps very quickly. And there's a reason these foods are, engineered in that way. So there's so many mechanisms. We could also talk about the amount of salt. And of course, you will all know very well about blood pressure. And there's so many different aspects that are linked to ultra processed foods. But the problem is what I'm discussing is all, oh, it could be this, it could be that. And we just need science to explore and take seriously how our overall diets cumulatively affect our long-term health. One other little tiny thing that I find quite interesting is longevity and aging. and studies on telomeres and lengthening as well of our chromosomes, and the fact that those that eat more fiber have potentially been shown to elongate their life by 5 years. So we need to explore the impact on our heart health and all sorts of areas down to our DNA, I think, with our diets.
That was a fascinating deep dive into a lot of mechanisms. And if you are listening to that and you want to know more, then Rhiannon Lambert has lots of fantastic books. And you can also go onto the Nutritank website and find some great webinars and courses on a lot of those mechanisms. So I want to talk about something that was quite controversial. A couple of years ago, when ultra-processed foods became quite big in the media, social media, and within this space, we started to talk about some of our staples, bread and cereals. These were demonized in some ways. Was that helpful, or was that harmful advice? What do you think?
How it was presented on social media was not helpful. I think it was very demonizing. Language used, it can fearmonger. And then without the correct solutions or empathy or understanding behind those messages that were carried out originally, that's not helpful to the average person in the UK. But to somebody that can afford the means to change their dietary lifestyle, it is very helpful. You've got this kind of sector of who I would refer to as the worried well in the UK, or those of us that are able to spend a bit more headspace thinking about the type of bread we buy on the shop shelves. What it has done is raise an awareness on fibre, which is amazing. I mean, I didn't ever dream that when I was writing this book on fibre would be trending on social media. You just can't predict these things. And it became a thing with the younger generations, fiber maxing and all sorts of trends. So demonizing food is never okay. And you will never find any credible nutritionist or dietitian demonizing and walking down the supermarket saying this is toxic, this is bad, because that messaging is quite frankly irresponsible, lacks complete and utter nuance of what any person that buys these items is going through. But what it has done is forced companies to change. So I consult for a lot of food companies within the business, and we're hopefully going to be working with one in particular, which is one of the largest providers of bread in the UK. And they want to change their driving core mission to health for the first time ever. They sell crazy millions of loaves every single week. And if they can change their flour deck to contain more fiber, and they can have a look at the amount of salt and sugar in their everyday white loaf that most people are buying over their brown loaf, that's a beneficial change. And that's driven by consumers. So there's two sides to the conversation. But sadly, always the nuance is lost. It's clickbait. We know that these drastic headlines spread like wildfire compared to the lovely balanced nuance of if you are able to buy a fresh loaf and you have a freezer at home, that's much better for you. And that will pay off with your, fiber or your omega-3 goals if you've got some seeds within that loaf as well. If you can have time to look at all the additives and emulsifiers on the back of the packet, that's really good. You'll be cutting down slowly. But for the huge percentage of the population that really need this advice, it's just not remotely helpful.
So true. It's amazing how when we first entered this space, how we had, big headlines or trying to grab attention, but realizing really quickly how important it is to have so much nuance behind everything that you put out there, because it can be complicated and there's a lot of different factors at play. And I think that was just going back to the other point you made about fiber and how it can improve telomeres and longevity, and it really is the simple stuff done well. The simple and actually the cheaper stuff in life done well that can really help us in the long term.
It's not the lotions and potions, and I think
no.
I think a lot of patients will be going to you or to doctors and saying, look, I'm taking this green powder, you'll get that end of the spectrum too. You know, I've bought collagen. Is this going to change my health? Am I going to live longer? And actually, the amount of money they've spent on these supplements versus just changing their bread, pasta, and maybe cooking one meal every other day. It's the biomarkers that you would be looking at obviously would change from the diet and not from the supplementation.
Ryan Johnson, take note. There you go.
I think he's in a category of his own.
He has done a lot on changing his diet.
He's in his own little pocket on the internet.
So I just want to ask a bit about list of products or list of ingredients. Actually, before I ask that question, this goes back to the point you were making on social media about scaremongering. What do you say about this social media point being made that if you can't pronounce the name of the ingredient on the back of the packet, or if your grandma didn't cook with that ingredient back in the day, then you shouldn't be eating that food?
It's just not helpful again. But then I think that's a very educated matter. I think that comes down to your education and your background to decipher that message. The problem is it puts so many foods out of reach for people that can only afford those foods. And also the people that need the fortified foods the most are often the ones that won't know that ascorbic acid's vitamin C or what folic acid means, or, you know, all these different terms. Bifidobacteria on the back of a yogurt pack is just the name of a type of strain of bacteria. Those words sound quite terrifying. You know, you wouldn't want that in your cupboard at home. But I can absolutely see the logic behind it too. This is where these fallacies fall into play, because of course I'm not going to have inulin powder in my cupboard at home. Yet inulin is often added to many products to add the fibre and the bulk. And perhaps that would benefit people because we know that 96% of adults don't get enough fibre in the UK. So maybe I'd want those adults to eat those items that have extra fortification within them. So that messaging is not helpful for so many reasons. But again, it has sparked a conversation as to look at your ingredient list, which is good. Please, you know, we're still over consuming salt. We are consuming too many emulsifiers. Is it really necessary that we have that particular food item right now? Or can we live without it and just make it an occasional item rather than an everyday staple? And if we can gather some sort of common sense decisions from those old, you know, that messaging, great. But I don't tend to use it because I'm obviously a fan of, if you can't have cow's milk and or for ethical reasons you don't want to, I'd love you to have the fortified iodine, because I know that's really hard to come by in your diet. So I don't think it helps that issue at all.
Very, very well put. And for our medical doctors and healthcare professionals, how can medical doctors give balanced, practical advice about ultra-processed foods without creating fear within their clinical practice?
I think it starts with how you deliver the messages, obviously with kindness and compassion, understanding and saying, look, we all eat ultra-processed foods. We can't really avoid them in today's modern environment, but what you can do is try and cook one meal more each week. And what you can definitely do is have a read up on ultra-processed foods, and don't go for those voices online. Actively stay clear of the clickbait grabby voices and try and get a more balanced opinion on it. Because I think cereals are a really good example you actually raised earlier. I didn't quite delve into. They can be such a wonderful, convenient item if they are the correct ones. If they are the all bran flakes, shredded wheat type Weetabix cereals. Obviously, I think most people know Cocoa Pops and granolas are very laden in sugar. I would like to think that message is out there for a lot of people right now. Those are ultra processed foods, but it doesn't make them bad. So try and focus on your lunch and your dinners more than worrying too much about the other things. So it's like step by step. We can't overhaul our diet
Step
all
by
in
step.
once. You don't have long with a patient. So if you're just kind and positive rather than fear mongering, you're bound to get more of a response from a let's just add one more thing in each week. Can you just add a can of beans into the curry you already know how to make every week? That is a win.
And that's a really great way of getting the patient on side, and also starting from where they are, and not trying to go above and beyond, but really knowing where your patient is and understanding what their barriers are. And more what we're doing at Nutritank and within the wider community is health coaching, and it's actually not just about the nutritional knowledge, it's about how that you deliver that information.
Delivery, it's interesting, obviously, for me as a registered nutritionist who started off in clinical practice. For me, I had to actually go and do another course on psychological interventions to disordered eating and food, because actually getting patients to adhere to dietary change, you can't just write out a whole list and send them away with it. You have to understand that to some people, their idea of health is a vegetable every day. To others, it's one a week. It's just wildly variable. And I have found if you are just kind, encouraging, and positive, that's the best way to see the results. You just don't have the time in 10 minutes to delve into nutrition. And if you can give them some good resources to go and read, that's probably good.
Let's talk about fiber. So high fiber intake is a smoking gun when it comes to improved health outcomes.
Amazing.
However, fiber intake remains seriously low within the population. So what are the most effective ways we can tell our patients to increase their fiber intake? I know that there are some people who say that it can cause indigestion early on, but what do you think are some practical steps?
First one is do it slowly. Don't just go home and suddenly say to a patient, try and add fiber to every single meal. Just start one meal at a time. Tackle breakfast one week, lunch the next week, dinner the next. Send them to a resource. They can get the fiber formula, my book, or look online even on my Instagram, Nutritional. Send them to places where they can get healthy inspiration for fiber. But lots of water. Do it slowly, take their time. The benefits are even to people's wallets. If they just swapped the amount of animal produce they had for protein each week and replace that with beans and pulses, you are saving so much money and increasing your fiber and not missing out on the protein. I think it's a complete misconception. The protein myth has actively detracted and not helped our fiber goals and intakes, because people are focusing on their plate on that animal protein, be it chicken, meat, fish, eggs, whatever it may be, and perhaps if you're lucky, some vegetables with it or a small bit of carbohydrate, but it's not a large enough focus. And 86% of children in this country don't hit the fiber goals, 96% of adults. And now you know that nearly every sandwich you buy in the UK doesn't contain enough. We need to be snacking more on fruits, on vegetables, and think always, what can I add in? Not what can I take out. Don't worry about your protein goals. Everyone's hitting. Unless you have a specific condition with a patient, it is rare that you get people that aren't hitting their protein goals. It's the fiber goals that are and have always been every nutrition professional's goal from the beginning. Digestion's where it all happens.
Digestion is where it all happens.
Yeah. Slowly.
What slowly, but you'll get there. So what can we say? I know that inflammation is such a big topic within social media, and it's bandied about quite a lot as a buzzword. But what can we say to our patients about eating fiber and reducing inflammation? What is the mechanism behind that?
I love this, because you can really say to your patients, you can say, look, there's no one magic food in isolation or diet, but what you can do is think about how you feed those bugs that live in your tummy, because they train your immune system and look after your gut where you digest your food, and that keeps your inflammation low, and that's going to help you live longer and be healthy. For us medical scientist is, it's the mechanisms between the gut bugs and that interaction of short chain fatty acids and butyrate and linings of cell walls. But your patients just need to know that if they follow a Mediterranean diet, or they have some lovely healthy fats and a nice balanced diet, and they reduce the ultra processed foods, then they can help with reducing their inflammation. And that means if they have an energy drink every single day, can they start by trying to have one every other day? What can they add in instead? Oh, instead of that energy drink, can you eat an apple, or can you get an orange or a banana? Like, what fruit do you actually like? Can you try and have it a bit more? There's, fruit's been demonized too for some bizarre reason. I don't want them to buy a fruit juice. I want them to eat a piece of fruit, and that also saves them money. So it is a win-win once we can get these lifestyle changes. I think a lot of people associate lifestyle changes with having to give something up they love. And that's where we see the resistance a lot of the time. They can still have that chocolate bar. I just want them to have the apple as well.
That's some really important points there. Thank you. So 2 other questions on fibre. Number 1, what emerging research regarding fibre excites you the most?
Oh, when you say emerging, I'd say it's like right now. It's unbelievable how fast the focus has come on this particular topic in nutrition. Nutrition's a nightmare to keep on top of. I like the conversations around plastic. Again, only a worried well type conversation, I would actively actually say. You've got to have enough headspace to be able to think about microplastics in your food to even go down this pathways. It probably won't appeal to many people. But for me personally, I'm really interested in how we can excrete microplastics with the help of fibre. That particularly for me is fascinating. And of course, the aging component, our skin, how it looks, can we help with our oral microbiome, our skin microbiome, because of how we're nourishing our gut microbiome with the types and different variety of fiber. I should have really emphasized in this conversation, you can't just have the same food every day. It's variety. Variety is a spice of life. And with emerging research, that's the space I'm going to be watching the most. Can fiber be more beneficial than the lack of research we have for collagen that everyone's jumped on board? It's amazing how collagen has so much weight in the beauty industry, for instance, with so little robust, if any, research, when there's so much more for fiber. Let's watch this space.
And I guess the medical-minded would want to know a little bit more about the clinical application of testing our gut microbiome. So patients may come in and say, okay, I want my gut microbiome tested because you told me that it reduces my inflammation.
Wow.
What do we know about that?
Okay. That's definitely not something that I think is on a public health level yet. We don't, unless somebody is willing to spend a lot of money on a test kit in laboratories, even that is debated. I know that it's something at King's College London they do a lot of. My advice for anyone that's interested in that would actually be to have a look at what they're doing at King's with microbiome research. I believe they're leading the way there. You can, you would know as medics, you do stool samples, you send things off, but I doubt you have.
We do, but very
a list of
when everything's going quite wrong.
Yeah, exactly. It's done. And I think maybe one day we'll have enough money. Let's dream a little bit in the NHS and in the medical system to invest in. Let's have a look for Akkermansia and different bugs that we've discovered in the microbiome that help clean up our gut lining and are linked to wonderful positive outcomes. That would be nice to see. It really would. And I would actually say to your patients, and I would just say, I would love to see one day us evolve science to the point where we can offer everyone a microbiome test kit. But at the moment, it's very hit and miss where you go to have a look. But there are, if you want to spend the money, they can be very expensive. But we do know that, of course, there are many programs out there. Professor Tim Spector's, for example, the PREDICT research that Sarah Berry's leading as well. And you can also add that microbiome's now linked to other outcomes like menopause. It's linked to our mental health. it's not just linked to how our immune system works and our weight. It's linked to reduced risk of cancers. It's linked to our mental health, hormones, how it's linked to a whole world of undiscovered entity. But the problem is social media is ahead of the science, and that's hard to convey.
Okay, so do you think it is important that medical doctors, medical professionals are taught nutrition and how to discuss it with their patients, or do you think they should stay in their lane?
I think a bit of both, if I'm being completely honest. They have to understand. You all have to know that what you eat can impact your mental health, and it can impact your heart, and it can impact your risk of cancer, and that it can save the NHS millions by just prescribing a healthier diet. But what we need to see in place is, I think, absolutely, you need to have that foundation knowledge, because otherwise the understanding isn't there. We need to know that. But you also need to know where to refer people to delve deeper into it, because everybody's unique. And the issue we still have in nutritional science is not only how new and emerging it is, it's the fact that every single person is unique. And one diet will work very differently for someone else. And as you all know, some will have a bag or different areas of their life that mean they cannot just go and follow a simple diet, or they're celiac, or there's different reasons. And in that case, referrals to dietitians should be made more available. This is a system issue, really, with availability to health professionals in the nutritional field. But just know, registered nutritionists with the Association for Nutrition, dietitians of the British Dietetic Association are your go-to. Educate yourselves, because the more you know, any little nugget of positivity you can put into you're the first point of call into someone to make a dietary change or look it up. Do I believe lots of doctors on social media should be delving into nutritional science? That's another issue. But if they've had no training in it. But currently, yes, let's empower everybody with nutritional education.
Very positive. So, last two questions. What is one resource, book, or tool you would recommend our audience to explore today?
We've discussed predominantly ultra-processed foods, I'd say, and fibre. So if it's a free resource that is there for everybody on the internet, I would probably go to, first of all, the first 1,000 days, I think is really interesting for medics to look up and read about how our bodies are shaped by nutrition from the womb onwards. That's my first little go there first. Then obviously I've got lots of books on these subjects, the unprocessed plate, and perhaps start with my encyclopedia, The Science of Nutrition. It's a good one for GP surgeries. It's a really good one that I know a lot of people have in schools and universities. It's illustrated as well as referenced, so it hits both sides of the coin. The NHS guidance, the Eat Well plate, is okay. It is okay. I do feel it could obviously do with an update, but we can't bash it. You know, if most people did just follow the Eat Well plate, we would be in a better state.
Yeah.
I'm not very good
That's
at also bigging.
That's another podcast episode in how we can improve that. There's so many other episodes off the back of this. So thank you. We'll put those resources into the information.
I should add the Wellness Scoop podcast. If anyone's interested in busting headlines you read in the newspaper, I do that every week with Ella Mills, and we have episodes every Monday and Thursday. They're free. You don't have to pay to listen to them. But we go through the confusing headlines each week. So that can be another area where you get patients coming and saying, I've just read in the Daily Mail or the Times, the two extremes, but I've just read in both papers that red meat's now good for me, and then it told me last week it was bad for me. So we dissect those.
Oh, that's a brilliant resource. I'll add it into the notes. And what one practical change listeners could make today that would have meaningful I'm going to start that again, sorry. What is one practical change that our listeners could make today that could make a meaningful impact in their life or health?
Eat more beans. And pulses.
Love it.
That would be my first
Simple.
one.
Beautiful.
And the cheapest form
How
of
can I-
protein you can possibly buy.
I love that. I love that product, bold beans. They are delicious.
They're like your gourmet,
I know
but we can't demonize the
Yeah.
Heinz beans. You know,
No, we
they're all
can't.
just extra fiber, but they taste really good. Yeah, they do.
For some reason, it's the one in the in the glass jars, which just tastes better for some reason. But yeah, Heinz beans all the way. And how can our listeners find you?
I'm very accessible these days. Social media.
You are.
Yeah, everywhere you go, Nutrition,
Everywhere.
Rhiannon Lambert, on any platform, you will find me. LinkedIn, if that's more of your thing, I'm there. But predominantly, if you're looking for free recipes and inspiration, then I would head over to your social apps for that one, or any of the books. I have Amazon, any bookstore around the world. You can just search, and you'll find Rhiannon Lambert books, hopefully.
Rhiannon, thank you so much for your time. We really appreciate it, and we wish you all the best.
Thank you for having me. I hope it's been helpful.